in the name of God. We start to study anatomy today. At first, we learn about terminology of anatomy. In anatomy, we learn the location, duration, function, neurovascular supply of organs. At first, we learn the position of human in anatomy. The position is here. The person is standing. Upper limb is suspended in each side and look forward. Okay? All figures are produced by this position. First terminology is related to position, it's related to direction. Medial, lateral, superior, inferior, anterior, posterior, proximal, distal, and so on. Medial is near to midline. Lateral is far, very far, midline. For example, the nose is medial related to ear. Okay? The eye is superior related to nose. Nose is inferior related to eye. Okay? Anterior or ventral, posterior and dorsal. Anterior is front, posterior is back. Superficial and deep. This structure is superficial and deep. Superficial is a structure toward the surface of the organ, deep toward the center of an organ. These terms are used for end organ, ball organ, for example, heart. Proximal and distal. This section is near to root, is proximal, is following from root is distal. Nervous system is divided to parts. Central and peripheral nervous system. Okay? Central nervous system composed of brain and spinal cord. Peripheral nervous system composed of all the structure of the nervous system. Peripheral nervous system is divided. Peripheral nervous system (PNS) is divided to cranial nerves, and spinal nerves. Okay? In this figure, you can see cranial nerves. There are 12 cranial nerves. First is olfactory nerve. Olfactory transfers smell. Second is optic nerve. Optic nerve transfers vision. Third is oculomotor. Fourth is trochlear. Six is acquiescence. Okay? Oculomotor 3, trochlear 4, 6 acquiescence. These two nerves innervate extraocular muscles. Extraocular muscle. For example, my eyeball is toward, moved toward above, below, lateral, medial. Okay? All of these muscles are innervated by three nerves: oculomotor, trochlear, and abscess. 5 is trigeminal. 5 is trigeminal. Innervate face. 7 is facial. Innervate muscle of the face. Trigeminal, sensation of the face. Trigeminal, sensation of the face. Facial, muscles of the face. 8 vestibulocochlear. Vestibulocochlear. This nerve is divided into two parts. Vestibular part is related to balance, equilibrium. Cochlear part is related to hearing. 9 Pharyngeal. Pharyngeal. Innervate tongue and pharynx. 10 vagus nerve. Vagus nerve. Innervate all organs into the thorax and abdomen. 11 accessory nerve. Accessory nerve is just a motor nerve innervate this muscle. For example, this muscle is trapezius, this muscle is sternocleidomastoid muscle. And 12 is hypoglossal nerve. 12 is hypoglossal nerve. Innervate muscle of the tongue. Innervate muscle of the tongue. In this figure, you can see first cranial nerve is olfactory for smell. Second is optic for vision. 3 and 6 and 4 innervate muscles of the eyeball. Trigeminal innervate skin of the face. The skin of the face. Facial nerve innervate muscles of the face. Muscles of the face. Vestibulocochlear is made to balance and hearing. Glossopharyngeal innervate sensation of the glottis and pharynx. Vagus nerve innervate all structure into the thorax and abdomen. Accessory nerve innervate this muscle. This one is sternocleidomastoid. 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 And trapezius. This one, sternocleidomastoid. This one, trapezius. And finally, the hypoglossal nerve, cranial nerve, innervate muscles of the tongue. Okay. But for us, the spinal nerves are very important. The spinal nerves are very important. In this figure, you can see spinal cord has 31 spinal nerves. Okay? These nerves are divided to 8 cervical spinal nerves, shown by C1 to C8. 12 thoracic spinal nerves, shown by T1 to T12. 5 lumbar spinal nerves, shown by L1 to L5. 5 sacrospinal nerve shown by S1 to S5. And finally, 1 coccygeal nerve. 1 coccygeal nerve. Okay? C1 to C8, T1 to T12, L1 to L5, S1 to S5, and coccygeal. The spinal cord is located into the vertebral column. Vertebral column. The vertebral column is formed by vertebra. The vertebral column is divided to cervical vertebral column. It's formed by C1 to C7 vertebra. This one is vertebral, previous was nerve. Thoracic part is formed by T1 to T12 vertebra. Lumbar part is formed by L1 and L5 vertebra. Sacrum is formed by S1 to S5 vertebra. And coccyx is formed by 3 or 4 coccygeal vertebrae. There is difference between vertebra and spinal cord. Okay? The vertebra is 7, 12, 19, 24, 29, 33. 33 vertebra forms vertebral column, but 31 pairs spinal nerves form spinal cord. The spinal cord suspend into the vertebral column. This one is intervertebral foramen. Intervertebral foramen. The intervertebral foramen is bounded by this one is vertebra, this one is vertebra. Two vertebrae articulate posteriorly by articular process and anteriorly by intervertebral disc. Okay? This area is called intervertebral foramen for exit of the spinal nerve. The intervertebral foramen is bounded superiorly by pedicle, inferiorly by pedicle, posteriorly by articular process, articular processes, okay? Anteriorly by body of vertebra and intervertebral disc and intervertebral disc. Okay? This one is intervertebral foramen for exit of spinal nerve. For this reason, when the intervertebral disc is herniated posteriorly, is bulged posteriorly, press on the spinal nerve and produce pain, anesthesia, okay? Motor dysfunction. In this figure, we can see the vertebral foramen. You must learn boundary of this foramen. Superior and inferior is bounded by pedicel, anteriorly by bodies and intervertebral disc, posteriorly by articular process. In this figure, you learn the exit of the spinal nerves. Cervical spinal nerve exit above same vertebral number. Exit above same vertebral number. For example, C1 exit above C1 vertebra. C2 exit above C2 vertebra. Or pass through intervertebral foramen between C1, C2. Okay? C5, 1, 2, 3, 4, 5. C5 exit between C4, C5 intervertebral foramen. But other spinal nerves, or below spinal nerves, thoracic, lumbar, sacral, exit below same vertebral number. For example, L2 exit through L2, L3 intervertebral foramen. L1, L2 intervertebral foramen. Okay. In this figure showing difference between somatic and visceral nerves. Somatic nerve exit the spinal cord and directly move toward end, for example, muscle. But visceral nerves exit the spinal cord, okay, have two synapses into the ganglion, and post-ganglion nerves terminate to target. Okay? So, somatic directly, visceral indirectly terminate to organ. Okay? Other name of visceral nerves is autonomic nerves or sympathetic and parasympathetic nerves. Okay, this rule is used for sympathetic and parasympathetic. If this fiber is sympathetic, this ganglion is called sympathetic ganglion. This fiber is parasympathetic, this ganglion is called parasympathetic ganglion. What's function of the sympathetic system? The sympathetic system innervate vascular, okay? Innervate vascular, sweat gland, and arrector muscle. Arrector muscle. What is arrector muscle? Erector head. Okay. In addition, innervate all sphincter of the body. All sphincter of the body contracted, closed by sympathetic nerve. So sympathetic nerve has four functions. Innervate vessel, innervate sphincter, innervate sweat gland, and arrector muscle. What's function of the parasympathetic system? parasympathetic system innervate all smooth muscle in digestive, in respiration, in heart, and so on. Okay. Stimulate exertion, stimulate secretion of the all exocrine glands, except of sweat gland, salivary gland, lacrimal gland, mucous gland, serous gland, into the lung, into the heart. Okay, all of glands are stimulated by parasympathetic, except of sweat gland. And finally, parasympathetic inhibit the contraction of the sphincter. Okay? The sphincter of the body is relaxed, is opened by parasympathetic system. In this figure, you learn about component of the spinal nerves. Component of the spinal nerves. This one is C1, L1, T1. All spinal nerves has common structure. In this figure, you can see this fiber is sensory. Sensory from this cell. For example, stomach. For example, stem. For example, lung. Okay. This fiber transfers sensation from the viscera to this part. It's called dorsal root of the spinal cord. Dorsal root of the spinal cord contains only sensory fiber. Dorsal root contains sensory fiber. This part area is called dorsal root ganglion. Contain body of sensory nerves. Okay? So, sensation of the viscera transfer to dorsal root into the spinal cord. This area, you can see sensation from somatic area. What is somatic? Visceral were sympathetic and parasympathetic. What is somatic? Somatic nerve innervate skin and musculoskeletal system. Skin and musculoskeletal system. What is musculoskeletal system? Muscle, voluntary muscle, okay, tendon, and bone. All of them as a whole is called musculoskeletal. Skin has sensation, pain, temperature, touch. Okay? What is sensation of the muscle? Sensation of the muscle is called proprioception. Proprioception. I can sense contraction of muscle. My elbow is flexed. I don't see, but I sense. This sense is called proprioception. This sense is transferred by somatic nerve. Okay? Somatic nerve innervate voluntary muscles and skin and musculoskeletal system. The sensation of the muscle, the sensation of the skin, the sensation of the bone transferred by somatic nerve through dorsal root of the spinal nerve. Okay. visceral nerves. Motor neuron of the visceral nerve has axon. This axon moves toward ventral root or anterior root. This one is dorsal root containing sensory fibers. This one is ventral root containing motor fiber. Somatic and visceral motor fiber. This visceral motor fiber pass through ventral root and enter into the spinal cord. These fibers have the synapses into the ganglion. For this reason, these fibers leave the spinal cord and enter into the sympathetic ganglion. Okay? This one is the spinal cord, okay? This one is spinal cord. This fibers is sensory fibers. This fibers is sensory fibers, okay? This fibers is sensory fibers. Sensory fibers. Sensory fibers form dorsal root. The body of the neuron is located in this area. This area is called dorsal root ganglion, DRG. Okay? Type of this fiber. Type of this fiber can be somatic and visceral. If this fiber origin from skin is somatic, origin from viscera is visceral. Origin from stomach intestine is visceral. But inside you can see motor neurons, okay? The blue showing somatic motor neurons. Somatic motor neurons, the axons of the somatic motor neuron leave the spinal cord, forms ventral root, and add to dorsal root, forms a spinal cord. A spinal cord is aggregation of sensory and motor fibers. Okay? These fibers is somatic. These fibers is somatic and move toward height. Muscles of the biceps, muscles of the quadriceps, so on. But these neurons are sympathetic. Axons of the sympathetic leave the spinal cord to ventral root and add to the spinal nerve. Add to the spinal nerve. But this fiber have the synapses into the ganglion. For this reason, these fibers leave the spinal nerve, enter into the ganglion, synapses into the ganglion, okay, and back toward the spinal nerve. This fibers is called periganglion fibers or periganglion fiber or white lamin because covered by myelin. Okay? This fiber, this one, is called postganglion fiber or gray lamin because has not myelin. This nerve is called a spinal nerve, has three components. One, sensory fibers. Two, motor fibers. Motor fibers is visceral and somatic. Okay. All spinal nerves has three components, five fibers. Sensory fibers, visceral motor fibers, somatic motor fibers. Okay? This spinal nerve, after pass, what is this? After pass 2, intervertebral foramen is divided 2, two branch. Okay? Dorsal, primary, branch, ventral, primary, ram or branch. Okay? Ventral and dorsal primary ram. The dorsal primary ram innervate, skin and muscle of the back of the body, okay? From head to base, all these skin and muscles are innervated by dorsal primary ram. Ventral primary ram innervate skin and muscle of the anterolateral surface. Ventral primary ram innervate skin and muscle of the anterolateral surface. I ask you, limbs, upper and lower limbs, innervate by which ram? Dorsal or ventral? Body is innervated anterolateral by ventral ram. Posteriorly by dorsal ram. Limbs, upper and lower, both are innervated by ventral or dorsal. Limbs origin from anterolateral surface. For this reason, both of them are innervated by ventral. Okay? Ventral primary. From this point, when I speak about spinal nerves, my focus on ventral spine. Okay? In this figure, we can see dorsal root, ventral root, dorsal root contains sensory, ventral root contains motor. Motor is visceral and somatic. Okay? All of them form spinal nerve. These fibers, the ganglion fiber of the sympathetic lead the spinal nerve enter into the ganglion, synapses into the ganglion, and back towards the spinal nerve. This part is called periganglion or white band. This one, postganglion or gray band. Okay? Come back to the spinal nerve, and spinal nerve contain motor visceral, motor somatic, and sensory. This spinal nerve is divided into dorsal primary and ventral primary. Ventral is larger because innervate anterolateral surface of the body and upper and lower limbs. Okay. In this figure, you can see parasympathetic system. The parasympathetic system is called craniosacral. It's called craniosacral. Okay? Craniosacral. Because parasympathetic fibers is located in some cranial nerve and some sacral nerve. Which sacral nerve? S2, S3, S4. What's function of these fibers? Parasympathetic. What's function of these fibers? Innervate organ of the pelvis, rectum, uterus, urinary bladder. Okay, all of them is located into the pelvis. All of them contain muscles. Isthmus muscle. This muscle is innervated by parasympathetic. Parasympathetic origin from S2, S3, S4. Parasympathetic fiber for bronchial muscles, for tracheal muscles, for esophagus, for gast, for intestine are origin from vagus nerve. Vagus nerve. Okay? Vagus nerve innervate all structure into drugs and okay. Which cranial nerve contain parasympathetic fibers? 3, 7, 9, and 10. These cranial nerves contain parasympathetic fibers. 3 parasympathetic fibers of the third cranial nerve innervate circular muscle of the eye and produce constriction of the pupil. Okay? Pupil is constricted. When I read near, pupil must be constricted. Which nerve contain parasympathetic for constricted of the pupil? Third cranial nerve. 7 cranial nerve contain parasympathetic fiber for a stimulation of secretion of all exocrine glands of the head. Exocrine glands of the head. Okay? Parasympathetic fibers of the 7 cranial nerves stimulate secretion of the all exocrine glands of the head, except of this one. This one is called parotid gland. Parotid gland is stimulated by 9. Parotid gland is stimulated by 9 cranial nerves. Eye sadness, eye crying. Which nerve stimulate lacrimal gland? Lacrimal gland. 7. My oral cavity is smooth. Okay. The salivary gland of the oral is stimulated. Which cranial nerve is stimulated? 7. Just this gland. Parotid gland is stimulated by 9. 10 cranial nerve is stimulated which glands or muscles? 10. All involuntary muscle of the thorax, abdomen, all mucous gland, all serous gland of the thorax and abdomen are stimulated by vagus nerve. Stimulated by vagus nerve. For memorize in Farsi, we use this one is se, haft, no, that. Se, haft, no, that. Sahand. Okay? For memorize of these nerves. These nerves contain parasympathetic fibers. This nerve contains parasympathetic fibers. Anastomosis. When two tubes connect together is called anastomosis. This tube, when this artery is called arterial anastomosis. When this tube is vein, is called venous anastomosis. For us, arterial anastomosis is very important. It's very important. For example, all of you is sitting. All of you are sitting, okay? There is an artery behind our knee. This artery is bending, okay? For this reason, blood flow to the leg is stopped. For this reason, your leg must be necrosis. Your leg must be cut. But there is anastomosis between upper and lower part and compensate this problem. Okay? Anastomosis is very, very important for us, especially in the anatomy of the limbs. In this figure, you can see types of anastomosis. This one is an artery. This artery is changed to capillary. Okay? Capillary. This capillary exchange substance between blood and tissue. After the blood forms vein. Okay? This one vein. This one is artery. This one is artery. Okay? This form of vessel is called end artery. End artery. Because this artery is changed to capillary, capillary is changed to vein. There is no helper to it. Okay? This one is end artery. End artery. The end artery is very bad because when this artery is cut, the blood flow toward capillary is stopped. This tissue is dead. Okay? Which part of body has end artery? Retina. Retina of the eye is supplied by end artery. For this reason, when I have diabetes, okay, diabetes constrict the retinal artery and produce, yes, Okay? Lightness. When artery change to capillary, capillary change to vein, change to vein, okay? In this figure you can see this structure head to capillary, head to artery. This one is called anastomosis artery because when each artery is cut, other compensate its function. This one is anastomosis. Anastomosis artery. Which part of the body contain anastomosis artery? Limbs, upper and lower limbs contain many anastomosis artery. For this is there is no vascular problem into the limbs. Vascular problem is into the eye, is into the lung, is into the kidney, because this part is end artery. Limbs has not vascular problem because of the name anastomosis artery. Okay? Artery change to capillary, change to vein. Okay? You can see this structure. What is this? This one is called potential anastomosis. There is no anastomosis. After a disorder, after a disease, this anastomosis is formed. Which part of the body has potential anastomosis? Heart. Coronary artery. Coronary artery for supply of the heart is potential anastomosis. I am standing here, maybe I involve okay, cardiac injury, infarction.
خدا نکن دکتر.
You transfer me to the hospital. After it, I come back here. Wow. Potential anastomosis is changed to active anastomosis. Compensate injury of this artery. Okay. Coronary artery for supply of the heart is potential anastomosis. Except of them, you can see this one. This one. Two set capillary forms in one alignment. Artery change to capillary, change to vein, change to capillary, change to vein. This one is called portal system. Portal system. It is very important. Which part of the body contains portal system? Digestive system. Digestive system has a portal vein. Portal vein. This one. Portal vein. Because two set capillary is inside of the vein. Portal vein. Digestion into the stomach. Okay. The substance move our blood. This substance again digests into the liver. After this digestion, come back into the blood. This system is called portal system. I have two sets, portal system into the body, portal system into the digestive, portal system into the hypophyseal gland. Hypophyseal gland contain portal system. Okay? This one, you can see artery directly change to vein. There is no capillary. Because in this system, we need exchange substance between blood and tissue. This one is used for regulation of the temperature. This one can be seen in tip of the fingers. For regulation of the temperature. For this is in winter, you use
Finger. Hand.
yes for prevention of addition of the heat.
Mouthpiece.
Keep the heat into the blood. This one is called shunt. Artery directly change to vein is called shunt. Okay. Directional terms. Plane. We have three plans. We have three plans into the body anatomy. This plan is called with Dr. Pasvash explaining for you. Okay? This plan is called sagittal plan. Divide my body, right and left halves. Okay? This plan is called coronal plan. Divide my body to ventral and dorsal, anterior and posterior halves. This plan is called horizontal. Divide my body to upper and lower one. Okay? What's function of this plan? This plan has two functions for me. One, what is this? What is this? Brain, right and left hemisphere. Okay? When I cut here, you can see this structure. You can see this view. Okay? This one is medial side of the hemisphere. When I cut this one, horizontal plan, you can see this figure. You can see this figure. Okay? When I cut coronal plan, you can see this figure. Okay? plan in anatomy help me to see a structure in many sides. Okay, medial side, lateral side, internal, external. For this is very important for me. Other function of the plan is into the movement. For example, what is this movement into the my elbow? Why? Why connection? Because this function do on surgical plan. One. And angle between two organs is decreased. Okay? For this function, shoulder flexion, elbow flexion, wrist flexion, finger flexion, all of them do on surgical plan. All of them has decrease of angle between two organs. Okay? So then is beneficial for in anatomy for study and thermal movement. Okay? Rest.